Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to Direct Connection. Tonight we continue our coverage of the coronavirus outbreak by connecting you to expert answers to your questions about this disease. Joining us for our Your Health segment is Matthew Freeman, Associate Professor in the Department of Microbiology and Immunology at the University of Maryland School of Medicine. Matt, it's nice to see you again. It was 5 weeks ago that we got together in studio. We weren't this socially distant. And I think at the time there were 5 cases in Maryland and there's close to 9,000. What I want to ask you first is we've had other respiratory diseases go around the world before, SARS, MERS, other things. Why did they not hit the Western world, the entire planet, as hard as the coronavirus is hitting us?
So thanks for having me again, Jeff. The big difference between this virus and some of the other viruses you mentioned, like SARS and MERS, other coronaviruses, is that this virus transmits very, very well. It transmits like another cold virus, so the other seasonal cold viruses we have for coronaviruses that we get in the winter. But also, it doesn't give you symptoms until 5 to 7 days after you get infected. And so for SARS, everyone who got infected, basically within 48 hours, they had symptoms, and they were quarantined at home or went to the hospital because they got severe disease. And for this virus, we're getting what's called asymptomatic spread, where you get somebody can be spreading the virus and then not know they're sick and walking around like normal. And so that's the reason for the social distancing that's happening now, is to keep people home who may be potentially infected but not know it yet.
So where we stand right now is that all of that seems to be having an effect. The social distancing, closing down businesses, the numbers are bad and they seem to be getting worse, but maybe they're getting worse more slowly. My question is, we can't just go back to normal, right? Because then the disease would pick up right where it left off.
Exactly right. So we can't just start moving again and everyone go back outside and back to work and school like nothing happened. The virus is still out there, even though we hope that we're getting to a peak soon. It's starting to maybe level off in our community here and nationally. But what we're finding is that there's different speeds and different kinetics of this virus in different areas. And so while some areas like New York City or Seattle are toward the beginning of their downturn, areas like our area, Baltimore, there's really not a sign yet that we're at the peak. And other areas in the country haven't seen that many cases, and likely they will see them soon. And so we're about 2 to 4 weeks away in different parts of the country from really peak virus levels. And so we're just following them as we go. And the best thing we can do is to really stay inside still, do all the right social distancing that we've been talking about, washing our hands, not going to the store, staying apart from people if you can, and doing everything that we've been instructed to based on our health department.
Let me remind our viewers, if you have a question about the coronavirus, this is your chance. You can send us an email, livequestions@mpt.org. We'll have that up on the screen and we will try to get you an answer. And Matt, let me start with a question that I know everybody wants to ask, which is, how do you safely go out and do stuff you need to do, like get groceries? What's a reasonable approach to that?
So I know this is a really hard question, and it's something that everyone wants an answer to. I think there's a couple different approaches. One is if you can get everything delivered, the better. Then you don't have to go out yourself. If there's a variety of different ways you can get food delivered from your local stores. But if you do have to go out, make sure, one, that you keep your distance from other people. The CDC now recommends that everyone wear some type of mask, some kind of cloth mask that reduces your spread of your own germs and your own virus to other people, just in case you really are sick. And then staying away from people in the stores. So washing your hands more after you're done shopping. Keeping your distance from other shoppers. Going at times when it might not be as busy, and really just being smart about being a good infection control agent by keeping the distance from other people.
What about the people who work at the store? I mean, suddenly, work in the the checkout line at the Giant has become, like first responder sort of hazardous duty. I mean, it's almost like
Absolutely.
being at a hospital. You think about the number of people who pass them by at close range, whether or not there's a little piece of plexiglass. If you were working that job, what would you do?
So this is exactly why we have to be aware of our community members. It's not just about us in this outbreak. It's about everybody around us. It's about our friends and neighbors. It's about the people at the store that are now seeing, a couple hundred shoppers a day. Being very cautious about how you are spreading your germs and potentially being virus to these people. So it's important we're all in this together. I know it sounds kind of hokey, but we all play a part in this response, and we have to take care of all of our neighbors.
Email question: how do you exercise safely, like running? And I saw one of these animations where it purports to show how if somebody were to cough or even exhale, where the little droplets that are potentially contaminated might go. And if you're the person running behind the lead runner, you could be right in the path of that. Do you agree with that? And what would you do?
So, everybody can't stay inside forever, and I totally get that, and especially during this outbreak right now, people want to get outside, they want to walk around the neighborhoods, they want to run. Again, you have to keep your distance from other people. If someone is infected with the virus but asymptomatic, they can breathe out virus droplets, and you can become infected with them. So just keep your distance. There's a huge dilution factor in the air. If you are right behind someone and they are breathing out virus, you have a higher likelihood than if you're 10, 20 feet behind them. So there's plenty of space outside if we all wanted to be out there, but just be smart about it.
Well, what do you hear from other researchers in your circles? And I'm sure everybody is focused on this. What has promise? Are there any therapeutics? A lot of things have been talked about, old drugs, new drugs. Is there anything that's supported by data at this point?
So there's a lot of things that are being worked on in trials, from chloroquine to other types of drugs that are being tested. We really have to wait for that data to come out. A lot of the trials now that are coming out in the news are not very well controlled. They need to be done. They need to be studies done in hospitals and medical centers around the world. And the ones that work will be discussed, and everyone will know about them. But the ones that are not controlled, where you don't know how some population would have done even without the drug, aren't really helpful. I know that we want to have drugs and we want to have therapies that work, but right now that we need to just wait for those studies. And I know it's painful to watch and to sit to wait for these things to happen, but the best way that we can go forward is to really wait and find the information that comes from really quality randomized trials where these things can be tested right away. And there are other therapeutics coming online soon. There's going to be antibody therapeutics. There's going to be vaccines in the 12 to 18 month range. But those are things we have to wait for, unfortunately.
I really don't want to be broadcasting out of my house for 12 to 18 months. I mean, I'm happy to have the opportunity. But, that's a ways off. Maybe, does the potential of a good antibody test maybe get us back to work faster?
So the antibody testing is a bit problematic at the moment. So the way that these tests work, and the basic way that you get antibodies is if you're infected by a pathogen, in this case a virus, your body responds by making antibodies, and those antibodies help clear the virus, right? That's just why you get a vaccine every year for flu. You get vaccinated for MMR shots when you're kids. This is the way the vaccines work, and they make antibodies. And so if you have been infected, either knowingly or unknowingly, but you could have been asymptomatic and never presented, you may have antibodies against this virus. And the question, though, is how good are these tests that are going to detect whether you're positive or not? But importantly, we don't know what those tests are really reporting. While they can report, yes, you have antibodies or not, we don't know yet what levels of antibody you really need to be protected. And I think that's really one of the problems with the current set of tests that are being sold out on the market for a variety from a variety of companies, is that nobody knows the amount of antibody that you need to be protected from this virus, and how long that antibody is going to last. So just saying that you're positive for the antibody by one of these tests doesn't really tell you anything. And I worry that we're going to start responding to these tests and feeling better about walking outside and being around and acting social like we normally do, just because we have this positive test, which doesn't really mean anything yet.
Two-part question about some existing vaccines. There was a report that people, not in the United States, I don't think, but there are other countries that still vaccinate little kids against tuberculosis, and that apparently that somehow causes a recalibration of the immune system, and they're having better luck against this disease. So that's part one. Part two is a viewer, Karen, wants to know, she had a pneumonia shot in January. Could she still get pneumonia if she got the coronavirus?
So I'll take part two first. So the pneumonia shot is not a protective shot, a vaccine against this virus. So that doesn't. It's a bacterial pneumonia, not viral. That's a different type of vaccine. But to the first point, again, there is a lot of suggestions that maybe other types of vaccines that we take for other reasons, whether it's TB, whether it's BCG, whether it's there's even a report about oral poliovirus vaccines that may be protective. They're all speculative, and there's no trials that show that these are effective at all against this virus. There might be trials in the future for this, but there aren't any now, and there's no data that really concretely shows that these are protective. So I think we have to be wary about these kind of speculative things that I know we want to believe in something that's going to work. I totally understand that, but we have to really trust in science and medicine to help us figure it out.
All right, here's an email question from a viewer who's sort of thinking the way I'm thinking. This is Elizabeth. If I buy groceries or receive a package, let's say there is COVID-19 on them, I sort of assume that somebody has coughed on everything. She says, if I do not touch it for a week or longer, will the virus die since it's not on a live object?
So I know this is a big worry. It's about all the packages we get in the mail, packages delivered to the door. Even when we go grocery shopping, picking up a box of cereal, if someone else touched it or walked by and sneezed on it. So the virus basically can live only a couple of hours on any type of basic, surface, cardboard, a little bit longer on plastic or metal. But that's it, a couple hours, and that's it. So if you wanted to be super careful, you could start wiping down everything. You could throw away the plastic bags when you come from the store, or recycle them, hopefully, or paper bags. That's totally, I understand that caution and worrying. Waiting 2 weeks to open to touch a piece of mail or a package that you get is overkill. So a couple hours max. If you want to wipe it down, you can wipe it down, but it's really not needed. The transmission of the virus in that surface to yourself to get infected is pretty low. The highest prevalence of virus transmission is really close contact droplets that you're going to get from your neighbors and friends when you're hanging out with them.
Okay, so I just had an email from a viewer who wants to know if the virus can go 13 feet. I don't know why exactly 13 feet, but that was her question. The second part of her question was to basically talk about herd immunity and when we get to that point.
So I don't know why 13 feet is important here, but the general distance we say is 6 feet. So large droplets can, when you breathe them out and you cough and you sneeze, they generally go 6 feet, and before they get there, that's fall on the ground. That's kind of your splash zone. So if you're 6 to 10 feet away from someone, you're generally safe. There is evidence that there are small droplets that when you breathe out, especially from people who aren't sick, they're not going to be sneezing and coughing. There may be virus in those small droplets just by breathing. And so those can go pretty far. They can sit in a room for a while. Again, it depends on the area and the volume of air in that room, how much the air has changed. Grocery stores are different than a small office. So all of these kind of engineering things matter. The second point about herd immunity, this is the way that we protect ourselves. This is why we get vaccinated for measles, where we try to get everyone vaccinated because you need herd immunity to protect everyone else. And the general idea from herd immunity is that if you have enough people that are resistant to the virus or pathogen in whatever that is, then you basically have less susceptible people in the population for that virus to go to. So it takes longer for that one infected person to spread that virus to someone else because they're surrounded by a lot of people who are not susceptible anymore. The numbers of what we need for herd immunity for this virus is somewhere in the order of 50 to 70%, depending on the model. So there needs to be a lot more people infected before we really have widespread herd immunity. to SARS-CoV-2. That's just kind of the nature of the virus at the moment.
I just have a minute. Viewer wants to know, can you get this twice? There have been stories about that, but I guess it's possible that, one of the tests was mistaken.
Right. So there has been anecdotal reports about this where people, they get sick, they go to hospital, and they get better, they get tested negative, and they go home, and then 2 weeks later, they get sick again. And I don't know what the answer is to these yet. Some are anecdotes. There hasn't been a lot of hard science showing what this is. This is something that people are working on now in a variety of countries around the world. And I think we'll be able to figure out soon by really sequencing the virus that the people get the second time versus the first time. And we'll know if it's the same virus, is it just growing out of that person that really wasn't gone, or whether it was really reinfection with a different virus from the community. And we'll be able to tell that pretty quick.
Matt, I just have 30 seconds for this, but when we left the studio 5 weeks ago, my takeaway was that you were pessimistic. Where are we tonight? If you're going to look into the future by a month, where are we going to be?
So I don't know. I think that when we left the story before, we were just in the very beginning of stages of this. I think we're still, we're definitely closer to the peak than we were a month ago, 2 months ago, when we talked before. But I think that we're not at the peak yet, and there's a lot of places in the country where they're still at the very early stage of this outbreak. And I think in Baltimore, where we are now, we're still in the upswing, and I hope it levels off soon. And then we have a good, 3 to 4 week downturn of cases, and I think that's what we all hope. And this is why just because we start going down a little bit doesn't mean that we can all go outside and act like it's not here anymore. We have to wait for the.
Matt, we're going to have to. We're going to have to leave it there. Matt Freeman, University of Maryland School of Medicine. We appreciate it. Direct Connection continues right after this.
Drop your phone and just be in the moment.
You guys ready?
Yeah!
It's a thrill to see images of a new world for the first time.
I want to look back and say, I learned something. That is where transformation happens.
I see people cry on this show, and I'm like, what y'all doing, man?
Out of the water came this giant thing.
That's incredible.
I feel it in my bones.
It's so totally amazing.
They hear that song and they're like, that's my story.
I feel it in my bones.
I have chills.
All of the joys, all of the sorrows.
This is where it comes from.
The rest is history. I feel it in my bones.
Our job is the truth.
I'm a journalist.
My destiny is to rule this country.
I will not run away. Yes, Mom.
It's very exciting.
Lord, I'm getting tired of being so lonely. I've got the fire inside that burns more than it lies.
Sir, are you a gentleman?
How dare he?
I'm a strong woman and I've got my own. I'm in control. I need somebody to hush.
I refuse to be tamed. Kiss me. It's terribly hot, isn't it?
No?
Please be mine again.
No.
Maryland has so far recorded 8,900 cases of the coronavirus and 262 deaths. The state has begun reporting the racial breakdown of patients, and among the cases where the race was known, 49% are African American. And among those who have died, 50% are African American. Meantime, the Census Bureau says 31% of Maryland residents are African Americans. To help us understand the racial disparity, we spoke with Dr. Farin Kamangare, epidemiologist and associate dean at Morgan State University. Doctor, thank you for joining us. One doesn't have to be a statistician to see that African Americans are being disproportionately affected here. When you look at the data, what do you take away from it?
You're absolutely right. When the coronavirus epidemic came, many called it the big equalizer because they felt everybody is affected, rich and poor and of different racial backgrounds. But like many other epidemics, it is affecting the most vulnerable most. For example, in Maryland, 30% of the population, approximately, are African Americans, while approximately 50% of the deaths due to COVID-19 are in African Americans. In other states, it's worse. For example, in Chicago, see that 30% of the population are African Americans, while 70% of the deaths are due to COVID-19 are in African Americans. In many other places, also in Wisconsin, in Louisiana, the same. You will see that the rates are much higher. African American deaths are disproportionately higher in African American.
I saw the data from Chicago, and that was startling. It's much worse than Maryland. When you look around the country, this disparity seems to exist in differing degrees everywhere. It's in New York City, for example, but at much smaller numbers. From a statistical standpoint, is that meaningful? What do you think is happening?
Absolutely. They are statistically significantly significant. They are meaningful, and there are potentially many reasons behind them. For example, African Americans and generally tend to have lower incomes, and they live in homes that are much more crowded. Therefore, social distancing is much more difficult. And in fact, when you live in homes that are very crowded, it encourages you to go out and hang out with other people, which actually makes the rates of the disease higher. People who have lower income are more likely to use mass transportation rather than their own car. And in mass transportation, you are more likely to get exposed to others who might have the disease. Likewise, African Americans are more likely to do jobs that teleworking is more difficult. The rates of incarceration are disproportionately higher in African Americans. Therefore, when something becomes prevalent in prisons, unfortunately, again, some racial groups are affected much more. There are other reasons too, which may not be quite as obvious. For example, there were rumors going on at the beginning of this epidemic that African Americans will not be affected by COVID-19. So those became viral in the internet, and that misinformation led to problems. In addition to those, once you have the disease, people who have other diseases, including asthma, hypertension, and diabetes, they're more likely to die of COVID-19. And unfortunately, because of disparities that have existed and disadvantages that have existed in this population for a long time, the rates of asthma, diabetes, and cardiovascular diseases and diabetes are higher in African Americans.
So in the short term and the long term, what's the solution? What should we be doing?
Well, we have to look at this at different levels. At individual level, trusted organizations, governments, and research funding agencies. Each of them have something to contribute. Individuals themselves, for example, they have to keep social distancing as much as possible and keep up hygiene as much as possible. If there are young people in the society who want to go out, please ask them not to, and leave the socialization for later, because sometimes younger people feel that they are immortal and they go do things that may not affect them quite as much as the people who are older and vulnerable. Also, taking medications regularly is very important, because those who have hypertension and diabetes are more likely to die due to COVID. So it is very important to be sure that those medications are taken regularly. At the level of trusted organizations, for example, churches and city department of health can have a major role, including by setting up billboards and speaking with people and having protocols for getting on mass transport, how far apart they should be sitting and how far apart they should be in lines, etc. That helps a lot. And encouraging the youth to not go out and not socialize much, and their universities can. Governments, particularly the federal government, can put in money into this. If there are people who are tested positive and they live in crowded homes, potentially hotels can be reserved for them so that they can be isolated. Or, for example, right now, testing is difficult, and if you don't have good information, access to Wi-Fi so that you have internet, sometimes you don't know where testing can be done. Therefore, governments and organizations can disseminate information on where testing can be done. Research funding agencies come in for longer-term solutions. They have to fund, and they are doing that. Right now, the National Institute of Health is funding research on the causes of these disparities so that research can be done for solutions that are long-term. One more thing that I would like to say is that we should not forget that this disease may affect death due to other reasons also disproportionately in African Americans. For example, cancer centers until recently funded transportation for patients who have cancer. Now they have cut that transportation. So people who are disadvantaged may not only die more because of COVID, but because of also other diseases, and that has to be paid. We have to pay attention to that too.
Dr. Farin Kamigar, epidemiologist, associate dean at Morgan State University. Sir, thank you for your time.
Well, thank you very much.
And that's Direct Connection for this week. We're back Friday with State Circle. For all of us at MPT, thanks for watching and have a good night.
Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.